On the street.
Okay, so one of the things that's interesting is they have these new medicines that are antacids. Okay, you know that there's the old antacids that have been around for a long time. Tums is a calcium carbonate antacid. Mylanta, remember Mylanta and Maalox, those are antacids. They have a mixture of magnesium and aluminum in them. They're antacids. We had those for a long time, and in the olden days, when I was a new surgeon, ulcers were a common problem that required surgery. In the United States and around the world, the most common operations were appendix, gallbladder, hernia, and then ulcer surgery. And we used to operate on people for bleeding ulcers and perforated ulcers all the time in the United States in the 50s and 60s. And then something pretty amazing, pretty remarkable happened. They invented some new drugs. Now you take them for granted. You can see them at Walmart and the grocery store. They are Tagamet, Zantac, and Pepcid. You've seen those in the grocery store? Those are what are called H2 blockers because they block the second histamine receptor in the body. And they made a tremendous decrease in ulcers in the world. All across the world, hundreds of thousands of people that would otherwise have required surgery for ulcers didn't require surgery for ulcers anymore. And we hardly ever do ulcer surgery anymore because of those drugs. Tremendous drugs. And they were only the beginning. They were pretty good. But then they came up with a new batch of drugs, and that's the Prilosec, omeprazole, Nexium, Protonix, Acifex batch of drugs. Those drugs are called proton pump inhibitors, PPIs. They stop the acid hydrogen ion from hydrochloric acid from being secreted from the lining of your stomach into the stomach lumen, and so no acid. The development of Prilosec, omeprazole, Nexium, Protonix, Acifex has been such an amazing development because it shuts down the acid. Very powerful. And in fact, right now, around the world, they're one of the most commonly prescribed drugs in the world. Millions and millions of dollars is being spent on those drugs, and millions of people are taking them. Now, many people are taking them because they have acid reflux. And the gastroenterology specialists have put those people on those drugs with a plan that they'll take them forever, their whole life. And they do that because they felt they were pretty safe. In fact, we thought they were perfectly safe. Now, having millions of people taking millions of doses for decades, we're finding out they really aren't perfect. There are some side effects, and there are 3 things to tell you about if you're planning on taking those drugs for years and years, which millions of people are. There are millions of people that basically have reflux, and their gastroenterology specialists have put them on those drugs forever. Okay? And they think it's a reasonable thing to do. So they're pretty safe. But there are 3 things to know about. Number 1, probably is not important to you. They've shown that the Prilosec type PPI drugs interferes with a platelet drug that's good for heart attack victims called Plavix. So the PPI interferes with the effect of Plavix, and so might increase your risk of a heart attack or stroke. So if you're on Plavix, you may want to be given some second thoughts to the Prilosec. Number 2 is kind of important to us. If you lower the acid in the stomach, it's not normal. Your body is supposed to have acid in the stomach, and that acid in the stomach helps with 2 things. One is it keeps out a certain class of bad bacteria. There's one particular bacteria that causes an infection called Clostridia difficile. Clostridia difficile causes a bad infectious diarrhea that can be deadly. And so very rarely people on long-term Prilosec have a slightly increased risk of this bad bug. So if you're on long-term treatment with PPIs like Protonix or Prevacid or Prilosec, you may want to be very extra cautious about an episode of diarrhea that could be from that awful, dangerous Clostridia difficile. But it's still very uncommon. The third thing is, if you have a lifetime of the acid in your stomach being low, the acid in your stomach is really helpful for absorbing calcium that makes your bones. So a lifetime of low acid in your stomach may have an increased risk of a long term of getting some osteoporosis. So there is some risk there. So you're always trying to balance things and make things better. So is it okay to take Prilosec or Protonix or omeprazole or Nexium forever? Well, there's always a risk, but there are millions of people that their gastroenterologists think that's okay. We probably say to our patients now, if you don't need it, we wouldn't take it. If you ended up having to take it, it wouldn't be the end of the world, but we should try and get you off it if we can.
So if in my case, if it was an ulcer and I needed to be in it for a few months, ideally it should heal the ulcer?
Yes. Well, we would expect if you have an ulcer that it usually people would put you on Prilosec or some other similar drug for somewhere between 6 months and a year or two, and then take you off and then see what happens. And they wouldn't necessarily get a lifetime of it. There are people, though, who don't have the MGB, who get an ulcer, come off of it, come back on it, and have trouble, and they just get their doctor who says, take it forever. I don't do that all the time, but it wouldn't be the end of the world. If you come off of it and it comes back again, then we want to think about another possibility, which you haven't done in your case yet, which is think about infection from a bad bacteria called Helicobacter pylori. And so if you have problems with ulcers that the Prilosec and the other medicines don't fix, oftentimes we'll give you a course of antibiotics and test for this bad bug called Helicobacter pylori.
I was tested for it and it came back negative, but I don't know if that's always the case.
It's not 100%, but that helps us a little bit. So what we're hoping is that, say, 6 months or a year of the antacids should fix your ulcer. And if it doesn't, then we need to investigate other reasons. But usually a couple of weeks, like in your case, 2 months, you're better. And not better, 100% better, but it sounded like 10 to 5, maybe 50% better. I don't know, 30%, 70%, whatever number. And so what we project is that over the next 6 months, that would all go away and you get perfect. That's the goal. And there are people, though, not you, but who have ulcers and have to take Prilosec forever. And it's not perfect. You'd like to be healthy enough never to have to take any medicine, just like taking a blood pressure medicine. There's risk of that blood pressure medicine. If I take a heart medicine, there's a risk of the heart medicine. If you take a baby aspirin every day, or if you take a regular aspirin every day, there's a risk to taking that aspirin. Taking a Prilosec for the rest of your life would have a risk to it, but it might be the right thing to do if somebody had bad ulcers.